Okay, so today I'll just talk about catheterization briefly. So when it comes to catheterization, this is a procedure where you pass a tube through the urethral opening, and this is done to help empty the bladder. So you will find that there are certain conditions which may make it hard for a patient to pass urine, and these conditions, you find that it could be urine incontinence conditions. It could be a tumor growing near the bladder and then compressing on the urethral opening, which makes it hard for emptying to take place. Or it could be other conditions, including renal failure conditions, where the kidneys begin to fail to perform their functions, and then the kidney begins to fail. So you find that in those conditions, the kidney begins to fail and urine cannot be emptied completely. So you find that in catheterization at the hospital, what they will basically do is pass a tube through the urethral opening. So this is what is known as a catheter. So the other hand should be lying on a receiver like that, and as you insert the catheter, you need to erect the penis upwards, and then you start pushing in the catheter in that particular manner. Once the catheter is pushed in a male, you can push in between 12 to 16 centimeters, while in a female, it can be pushed in for about 4 to 8 centimeters because it is short. So once you push in, you find that urine will start coming out on the other end like that. There will be urine coming out. That is the reason why you put it on a receiver, so that urine does not go on the patient's bed. But nevertheless, you would have had the incontinent sheet, the inco sheet on you, so that you prevent soiling of the linen. After pushing in the catheter, you need to secure this catheter so that it doesn't come out. So what you do is you are going to get a syringe and withdraw some fluids between 20 to 30 cc's, and you are going to push it in this particular tube. Once you push in that amount of fluid between 20 to 30 cc's, it will help secure the catheter so that even if you pull it, it can't come out. So you need to record these figures, because when removing the catheter again, you need to withdraw the equal amount as pushed in, so that you don't injure the patient as you remove the catheter. Then from there, this is known as a urine bag, and it will help collect urine as it is flowing from the bladder until a point when this patient regains full control of their urinary system. So you secure the urine, you secure the urine bag to this end in this particular manner, and the urine bag should not lie on the floor, as this is going to prevent infections. So you find that there are certain instances where the patient maybe has loss of sphincter muscles of the urinary system, and then they will need a urine they will need catheterization rather, so that it helps in emptying of the bladder. So this can be done to help in such particular patient with such conditions. So in simple terms, this is how you can do catheterization in a male patient, and then from there we can also look at how we can catheterize a patient in a female, catheterization in a female patient. So this is not the whole OSC procedure or how you can do it during OSC standard, but this is just some basics on how it is done. Thank you so much for taking time to go through the procedure. We'll go through some other procedures next time.